when we know the difference between PRP and a GFC treatment to treat hair fall and hair thinning, the question arises is, can these techniques, or for instance any other medical treatment, help us to regrow new hair, or let's say recover our baldness? Well, the answer is no, totally no. Once you have lost hair permanently and a visible baldness is visible on your scalp, the only way to treat it and regrow hair is through a hair transplant procedure. Patients spend a lot of time and money on various treatment. They take multiple sessions of PRP or GFC. They take medical treatment for a long time. However, even though these treatment can help in regaining the thin areas or strengthening your existing hair, but they will never ever grow hair permanently. The only way it can be done is through a hair transplant procedure. And also in certain cases and initial cases of androgenic alopecia, where patient has thinning in the upper area and in the crown, but his density is not evident, that is because the hairline has been receded. So in such cases, you need to reconstruct the hairline through hair transplant, and eventually GFC treatment or a PRP will help us to reinforce or strengthen the existing hair. So ideally, when patient is complaining of baldness and let's say he falls into the category of grade 3, grade 4 or grade 5, then a combination of a hair transplant procedure and a GFC treatment will solve all his problems. So we need to first identify the bald areas. Let's say a patient has bald areas present in the frontal area and in the crown area. So these areas needs to be reconstructed back through a hair transplant, and after that a GFC treatment, let's say 3 or 4 sessions of GFC, will help him strengthening his existing hair. But always remember this thing: once you have lost hair and a baldness has come into the picture, only a hair transplant procedure can help you. Thank you.